Oftentimes when we're planning the in vitro fertilization cycle, patients will ask, how long is all this going to take? The answer really depends on the patient's decision surrounding what they would like done during the cycle. If a patient is testing the embryos, pre-implantation genetic testing, to determine whether or not they're chromosomally normal, that's going to take a little bit longer. If they don't elect to do that, then the possibility of a fresh embryo transfer exists. Also, oftentimes it's best if we freeze the embryos and come back later after we've prepared the uterine lining. Those are all decisions that can be made during the planning phase and then also during the actual in vitro process. If the patient elects to test the embryos, then there is a phase 1, which is the stimulation phase, and then there is a phase 2, which is awaiting the embryo's report, and then a phase 3, which is the embryo transfer phase. All that together could take as long as 6 to 8 weeks. But if patients want the testing, then we have to be patient and wait for that. The stimulation phase is going to take somewhere between 8 and 12 days, typically around 10. That's the process of the patient doing daily injections at home, and we're going to teach you how to do that. And then when the ovaries are ready and the eggs are mature, then we can move into egg retrieval. That completes the stimulation phase. If the patient is testing the embryos, they are then biopsied by the embryologist. That genetic material goes off to the genetics lab, and the report is returned to us some 8 to 9 days later. Then we're able to plan for the embryo transfer. The embryo transfer requires 2 weeks of estrogen preparation of the uterine lining, and that is so much less trouble than the stimulation phase that patients are relieved when they find that out. Once we've determined that the lining is ready and receptive, then we'll bring on progesterone, and 5 to 6 days later the embryos can be transferred. Testing for pregnancy would require about another 9 or 10, maybe 11 days to determine. Once we've found out that the patient is indeed pregnant, 2 weeks later, we're able to do the first ultrasound. And then we can see and ascertain that the pregnancy is in the uterus where it belongs and that it has a heartbeat and is going forward. So the entire in vitro process could take as little as 3 to 4 weeks and as long as 6 to 8, maybe 10. Whatever is right for you is what we'll plan to do.